What's going on, everyone? It's Dr. Luke here with
Dr. David.
We are back with another Curiosity Corner. We know you've been hankering for this next episode and you just can't wait. So we're excited to talk today about
Overuse injuries, right? So it is August, it is back to school time. We thought it'd be a good time to put out some information for you guys in terms of what we see in the clinic. It's a very common issue in terms of athletes from youth, middle school, college, and high school, and the adult that maybe had some time off in summertime and are returning back to their sport. And what happens? They have an overuse injury, do too much, and they experience pain and maybe need to see us as a physical therapist.
Yeah, so if you are an athlete yourself, if you're a parent of an athlete, and you have a child that may be dealing with an injury, or you're worried about them picking up an injury as they get back into this high intensity training that comes along with preseason practices, two-a-days, this video is right for you. We want to talk a little bit about the concept of overuse injury. So David, why don't you talk about what is an overuse injury?
Right, so what we see is, say, an athlete is dealing with overuse injury is their body is kind of pushed beyond a stress standpoint from strength, stamina, performance, and their body responds with an inflammatory response, right? Which is pain. Their strength may be in deficit, which essentially leads to their performance being in deficit. So the tissue gets ramped up too quickly, is unable to respond to the load or to the stress demand, and the body responds negatively with pain.
Yeah, I think there's some really couple important points there. It's, your tissue needs time to adapt, and it also needs time to recover. All right, those can come hand in hand. But when you're only given a certain amount of input across the summer, and then you have to ramp up pretty quickly, the different tissues. So we're talking about muscles, tendons, ligaments, joint. The body hasn't had the adequate amount of time to adjust, and then these little incidences build up to the point where all of a sudden you have tissue breakdown, you get pain, you get inflammation, and that's what we see. There's not a really specific acute occurrence that people feel like. Maybe you get with a hamstring strain, you see someone running and they pull up and they grab their hamstring. That's more an acute injury. This is not what we're talking about. We're talking about slow buildup over time. So we really want to educate you guys on how to prevent that, or catch it before it becomes a problem. Some of these common injuries could be like tendonitis.
We've seen the elbow.
Stress fractures, stress injuries. So what are your typical discussions with parents and athletes about how they can prevent this?
Yeah, I think with any condition, it's always about what's the optimal way to prevent it, and then we can kind of talk about what the optimal way to treat it is. For me, it's mindset. It's kind of laying down the expectations of, let's say from May to August, if you are relaxing, which is okay, it's fine, right? You should be going on vacation and giving your body a time to recover. But if the expectation is come August 1st, you're going to be putting your body through 2 to 3 hours of workouts 5 days a week, and your body hasn't experienced it, what can you do in those 3 months to kind of maximize your time? I would say prevention-wise is do sport-specific activities, right? Train your body for what stress you're going to be placed upon, right? And so if we have football players, we know we need strength, right? If we have more of a track athlete, we know we need quick twitch. We know we need to, practice sprinting versus practice, long distance running. I think it's preparing your body in the most efficient manner with the mindset of what is going to be tasked of you, come August.
Yeah, that's very important because a lot of people just want to hit the gym hard. And they're wanting to lift as much as they can, get in strength training, and they don't build some of the dynamic demands that sport might need. But then when you get into your training now, where you're with your teams, your kids are with their teams, you need to really incorporate an adequate amount of rest and nutrition and sleep, because we're talking about that body repairing itself. And that's the time when the body is repairing itself. Rest, especially sleep, and then you got to provide the right fuel for that. So it's not the time to kind of just let your kids do whatever. You got to be really on top of them about hitting those things, especially if they're a higher level athlete. So I do think that we shouldn't neglect that part of it. And although it's talked about a lot you need to implement a plan for making sure you or your kids are getting that adequate nutrition, sleep, and recovery.
100%. I think you nailed it. It's like what you do in April and May should not be the same as what you do in August. If your body is being placed under this increased stress, you need to respond with the appropriate management, right?
Yeah.
It's like the point of talking today is like, how do you effectively prevent it? How do you manage it? And essentially, as a therapist, how do you treat it? But that management phase is doing exactly what you talked about, is allowing the body to progress the tolerance to load, right? And so if you are, staying up super late and then waking up at 6 a.m. to hit 2-a-days in the morning, you probably need to adjust your sleep to allow your body to recover, right? And you nailed the nutrition, nailed the new sleep. And from a therapist standpoint, what are you doing to recover to allow your body to then continue to tolerate a quicker turnaround, right? In terms of lacrosse ball, foam roller, progressive stretching, what you do out of season probably needs to be more in focus in the beginning part of the seasons.
Yeah, the worst thing for an athlete is injury, right? Time away from their sport. It's the most frustrating thing. It can lead to depression. It can lead to mood disorders, poor performance in school. These are the things we don't want to see. Although we treat it, we don't want to. We want to prevent it as much as possible. So we're giving you these tools today on this video. I know it's short, but we want to give you some tangible stuff to take away that you can help you or your athletes prevent these overuse injuries. And I think we've touched base on some of them. As far as sleep, nutrition, recovery,
setting realistic expectations. I
realistic
think that's the most important thing that you see
mindset.
Is like, I cannot take a 12-year-old kid who was playing video games, relaxing in the summertime, and expect him come August to tolerate doing 5 to 6 days of throwing a ball or high velocity and not expect a consequence, right?
Yeah.
I think that's the most important thing, is the mindset, setting you up for success so that we don't need to go down that role of, I have a shoulder injury, I have to manage it, and I have to kind of decrease my time in sport. That's what we're here for, is to kind of set you up for success. The expectation is, what are you doing in the summer months ahead of time? How can you manage that kind of initial ramp up phase?
Yeah, and we should also talk about year-round sports, right? Not being into multiple sports. So if you're very specialized as an athlete, or your kids are in one, maybe 2 sports year round, you better make sure that they have an adequate break in between their seasons. Because I see it more and more. It's like, I just got through my summer season of let's say volleyball. We have a week off and then fall season starts again. And the kids are 6th grade, 7th grade, and that's the only sport they're playing because they're trying to specialize to move up to the top tier of the team. Yeah. Well, that's essentially setting them up for certainty for an overuse injury and burnout. So, you have to take that into perspective when you're talking about rest. So if that's the case and that's your only option, you better be really dialed in on these other aspects of warm up, cool down. We should talk about dynamic warm-ups, not getting late to practice, getting there, 30 minutes early so that they can get adequate warm-up. Cool down, make sure you're implementing passive stretching, recovery work, foam rolling, and then of hydration and sleep. And these kids that are in grade school, in high school, they need 10 hours of sleep. They need 8 to 10 hours of sleep minimum, right? The adult needs 8. The kids are probably looking at 10. And then if you're talking grade school, middle school, they might need up to 12 hours for the body to regenerate. So you need to be planning for this for yourself or as a parent, and looking at their season, because they can kind of gel together. Don't wait till it's too late. So we're here for you at RecoverRx. We want to be a resource for you. If you have additional questions, you can reach out to us via social media, RecoverRxPT. You can certainly shoot us an email, info@recoverxpt.com, or shoot us a text. And we're happy to answer any questions you have. Or if you got issues that you're just not sure with yourself or with your athlete, we provide free injury screens here at the clinic. So hope this Curiosity Corner was beneficial for you, and we look to doing our next one.
Yeah, have a good start to the school year.
All right, bye guys.